coughing, itchy eyes? Does this sound like you? If it does, join the club. Millions of us are feeling that way, especially right now. It's allergy season and it hits millions of us pretty hard.
You said that picture makes you want to sneeze alone.
Yeah.
Well, experts say spring is one of the worst seasons for allergies. So Dr. Madan Kandula is a board-certified ear, nose, and throat specialist. Welcome back to the show.
Thank you.
Now, you say that there's an easy fix to the chronically stuffy-nosed people.
Right. Exactly. So the itchy, sneezy, that we don't have much to do with as far as procedures go, other than the medicines. Those tend to help with that. But for the stuffy nose, and that's a lot of folks. I mean, lots of folks who have allergy issues, that's their big complaint, is the way they just can't, when things hit, they can't breathe. And for those folks, we've got a nice new-ish solution for them that can make a big difference.
Which is great, because this time of year, it seems like there's a certain type of allergy or allergens out there that are really bothering us. How do you identify what's going on right now in this season?
Right now is mainly trees, and it sort of shifts through. So I mean, obviously up in Wisconsin here, it gets cold and then things start to bloom, and the blooms kind of go through the course of the spring, summer, and even into the fall. And so you kind of go from trees to grass and then over to more of the weeds and that sort of stuff. And so, you know, for somebody to have allergies, their body has to be sensitive to the allergens, and then what the body does is tries to block those off. And one of the ways it tries to block them off is by swelling your nose up, stuffing it up, and same thing, getting your eyes running, getting your throat irritated, trying to get that stuff out of there, which is great in concept. It doesn't work, and at the end of the day, you're miserable.
Right.
So.
Well, do you think that all chronic nasal problems are something that's related to allergies, or do allergies just kind of make it worse?
I mean, certainly I'd say lots of folks who have issues and blame everything on allergies. It's not just the allergies. If it were, then the medicines tend to be able to take care of that. And so lots of folks actually have just sort of a chronic either anatomic issue, which is sort of the biggest thing, where, you know, for instance, for allergy folks who have a chronically stuffy nose, the thing to blame that on are the things in the nose called turbinates, which are little humidifiers in the nose. Those are the guys, everybody's had a stuffy nose at one time or another. Everybody's had a cold. Some people, and this shows a picture of what this looks like, is looking up somebody's nose, and when you feel stuffy, you look like like you can't breathe. And what happens is those little humidifiers that are showing up there swell up, and some people, they're just chronically swollen, so they always feel like they've got a cold because that tissue is always swollen. And for those folks, the medicines really don't do the trick. I mean, they're just sort of banging their head up against the wall when they're trying to do the medicines, and it's not cutting it. And then, you know, a lot of folks never get, you know, past that point, and that's what we're trying to do today, is just sort of get the word out. There are other options other than just the medicines.
Especially if you suffer from a chronic nasal blockage, I would think. So you have what to solve the problem?
So
this is fairly new technology?
It's fairly new technology, and I guess the concept, what we've got is something to shrink down that swollen tissue. So permanently shrink it down so it's not able to swell up and plug you off. The key points with this is it's an in-office procedure. It's really low key. It's under local anesthesia. It's fairly painless, takes about 10 minutes, and makes a big difference. And it's a one-time sort of a deal. It can be repeated if necessary, but that's pretty rare. And it's something, again, if all you're hearing is the medicine, it's not doing the trick. This is something else that can give you a fix. It doesn't get rid of the allergies. It gives you more wiggle room, which is a big deal. I mean, if you've got more wiggle room, then the medicines have a chance to do their trick. You know, and sometimes you don't necessarily need to do the medicines as often.
So when you're doing the procedure, what do you actually do? Are you taking out something from the nasal cavity, or what are you doing?
We're actually shrinking down the tissue in that humidifier underneath the surface. And so this shows, and this is a cutaway, so this is like you're cutting somebody's head in half, and that little stick that you're seeing there is the probe. We just, through the nostril, we put that in and put that into the humidifier, connect it to a machine that creates energy, and that shrinks it down. And so it decongests the turbinate. We're actually not removing any tissue, we're just causing the inside structures to collapse on themselves and get out of the way.
And that's called the turbinate reduction.
Exactly.
The procedure is called turbinate reduction. Do people have to take time off of work? Because I'm wondering what the advantages of this procedure versus maybe other things that people try.
No, people don't have to take any time off of work, and this is something that lots of folks have multiple issues on the inside of the nose, the sinus issues and a deviated septum and then big humidifiers, but lots of folks don't want to go there as far as going to sleep and having a surgical procedure done. This is for folks who don't want to, you know, they might have other issues, but this is going to help pretty much anybody who's got nasal obstruction. This is an option that can help them. This is an option we can do in the office. This is an easy option. You know, there's not really really any downside to doing it, which is a big upside. And
not a lot of downtime.
No, exactly. Really minimal downtime. What you feel on the back end is you feel like you got a cold for about a week. So what ends up happening is those humidifiers swell up in reaction to me being there. It's annoying. It's not painful or anything like that. You just feel like you're stuffy for a few days, and then once they have a chance to really permanently shrink down, then you're on the other side of things. So very minimal as far as downside. And it fits. I mean, it fits lifestyle-wise with a lot of folks. Again, they don't want to take the week off of having a surgery done. They want to do something active, do something proactive, and this is it. I mean, this is a nice, real good option for those folks that unfortunately a lot of folks never hear about.
And insurance, is that covering it at all?
Yeah,
Really?
Insurance covers it, and so that's the other thing. It's sort of there's really no reason not to think to go in that direction. If you've got nasal obstruction, which a lot of folks do, and they just kind of put up with and figure that's the way life is supposed to be. So,
And I know a simple examination that people can schedule is a great way to determine if you're a good candidate for this procedure. Again, it's called the turbinate reduction procedure, and you can call the people at Advent at 414-771-6780 or find out more online at advent.md, and your office is located on Mayfair Road. Nice to have you.
Thanks,
Thank
Doctor.
you. Thanks for being here. Thank you.